Good evening, folks. It's Friday, November 13th. Yes, Friday the 13th. I never got a chance to actually post the video for you guys today because I was so busy today at the office. But I came home and I just had a nice little dinner, and I figured right before going to bed that I would probably make a little video for you and try to post it, quickly edit it, post it tonight for you to have on Saturday. And I figured what I would choose to talk about would be ESRCM. Now, ESRCM is a system that we here at Real World Indo have helped develop and is sold through Brasseler USA, and is essentially a solution to those who like reciprocation motion, except that instead of using a progressive taper such as Wave 1 Gold that is fairly fat up on top, that has been designed to be used with thermoplastic obturators that are obviously require a big thicker opening up on top in order to do vertical condensation or equivalent of thermoplastic techniques. This one, because of the fact that we can use hydraulic condensation, it's actually designed to be used with a more conservative taper such as an 04 taper. So the system involves the use of 3 finishing files. These are your final master files that are sizes 30, 40, and 50. Then you also have a file that is a expediter, which essentially tells you what you have in terms of the canal. You only have a large or a small canal in this technique, and we're going to go over the protocol so you can see what I'm talking about. And then you also have a ESRCM Scout file that helps create the path for you so that you can then in smaller canals have the ability to get your hand files down a lot easier. All right, so 1503 is your ESRCM Scout file. The 2506 is your expediter file or screening file. This is the file that's going to tell us what size canal we have. And then 30, 40, and 50 are our finishing files. Now, there is also a size 20 in the works that's soon going to become available. But at the present time, we have 30, 40, and 50 as our finishing files that addresses most of the cases. So let's go over the protocol very quickly. Size 10 determines the working length first. You get a 10 to the end. So in some ways, it is a more conservative preparation by hand than many of the other reciprocating files that require you to get a 15 or a 20 to the end. But then after 10 gets to the working length, you're going to use your 2506 as a screening file to determine what kind of canal you have. Now, you have only 2 options. You're either going to have basic or advanced canals. Basic canals are canals in which the 2506 goes to the apex very easily after 1 or 2 passes of rhythm motion, and we're going to talk about that quickly as well. Advanced cases are one in which after 1 or 2 rhythm motion, the 2506 has not reached the end of the route yet. So in basic cases, then once the 2506 reaches the apex, you have to decide whether you're going to finish with a 4004 or a 5004, and you can with time figure out which one's the right one, but you can sometimes just use your 4004 by hand at the beginning to just see if it goes to the end or not. If it does go to the end easily, then you use the 50. What you want is you want the file that finishes 2 millimeters short of the apex so that you can then drive that to the end, and that 2 millimeter of corking, you enlarge that end. Now, with advanced cases, 2506 does not reach the end, so you're gonna, in these cases, it's probably advised that you are going to have to enlarge it to a 1502 hand file. Now, if you're not a big fan of hand filings, like myself, what you want to do is you probably want to use the ESRCM Scout, which is it's a 1503, and it's going to help enlarge that much more quicker than you using a stainless steel size 15 hand file. Once the canal is prepared and shaped to a 1503 hand file, then here you're going to finish with a 3004. Now, you may say to yourself, well, why don't I just go back and finish with a 2506 in these kinds of cases? And certainly that's an option, but what I'd like you to pay attention to is that the 3004 is in fact smaller up coronally than a 2506. The 2506, because of the taper, it gets larger much faster. So once the 1503 is to the end, the 3004 will reach the apex quicker and will give you a slightly larger apical preparation than a 2506. But if you prefer to use a 2506 to the apex, that would be fine, and that would make you have only a 1 or 2 file system for this case. So the ESRCM protocol is designated this way, just a 10 hand file to the end. Use the 2506 as a screening file to determine whether you have basic or advanced cases, and then use the corresponding finishing file, which is 30, 40, or 50, in order to finish your case and match it with the matching bioceramic coated BC cone and hydraulic condensation using the BC sealer. Only in smaller cases, it would be advisable that instead of jumping from a size 10 apex, just get it to a 1502 or a 1503 Scout before you work the 30 down to the end. Now, the idea of a motion you want to use is the rhythm motion, which we've talked about in the past, which is 3 light strokes to engagement or to OTR. So the OTR gets engaged, you do 1, 2, 3, and each time you're going to hit the OTR, and then you back off, wipe the file, irrigate, and repeat it a second time before you move on to a smaller size. That's the idea there. So let's talk quickly about what this basic protocol is all about. So use a 10 hand file here, and then the 2506 would screen the canal to determine whether it's basic, in the case of basics, it's going to go all the way down to the end of the root. And then you're going to finish with a 40 or a 50, depending on what kind of canal you have. Now, what I said is that you could use the 40 by hand to see if it goes to the apex where it stops. But with experience, you're going to find out you're going to go either use the 40 or the 50 based on how much engagement you've been getting with your expediter or screening file. The idea of ESRCM is very simple. Basic and advanced cases are demarcated by really only using 2 files or 3 rotary files, which makes this system very much of a minimalistic type of an approach to doing your root canal therapy. The key here is that you have to use this rhythm motion. You're using it with either OTR, reverse OTR in a counterclockwise direction, because remember the ESRCM cut in a reverse direction, much like the Wave 1 Gold and Reciproc and ESR. Those files all cut in a counterclockwise direction. So you need to have either your Dentsply engine, which cuts with reciprocation, or the EndoSync Plus, which is the Brasseler equivalent that cuts in reverse OTR, which is the same thing, except that it's actually a torque-dependent reciprocation. So, in fact, it's a more intelligent form of reciprocation than the pure reciprocation that you see in the Dentsply system, which is just not torque-independent. All right, so let's quickly talk about a case here. I have an anterior tooth for you on a young patient who had, unfortunately, a history of trauma on this tooth. You can see the tooth is virgin, and however, it's testing necrotic. And this patient had a recent fall, unfortunately, and many times when people have had a recent fall, the tooth is not chipped. That means that trauma was absorbed into the tooth, and you can see a little bit of subluxation. The tooth has been pushed and torqued around, so it's actually pointing a little bit more at the apex, tilted more buccally, and that means that you can see the rarefaction at the apex and around the root. The tooth is testing necrotic and is positive for percussion. And so in these types of cases, especially in adult patients, since the root apex is closed, there is no chance of revascularization, and endodontic therapy should be done as quickly as possible to prevent the chance of inflammatory root resorption. And so we isolate the tooth with a rubber dam. And then I'm using the EndoSequence flowable dam material to seal the area for secondary isolation. It's a term that I've kind of coined. Primary isolation is your rubber dam, macro debris isolation, and the some kind of a flowable dam material, caulking material would be your seepage, crevicular fluid seepage isolation, that's secondary isolation. So after my 1557 access, straight line access, I use my E15D ultrasonic to make sure I remove that cingulum area to have a straight line access, so that my size 15 AccuFile here, and that's just the file that has a side cutout for the so that you can have your apex locator connected to it, is connected. And you can see here, what's nice about these types of files is that you don't have to grab them at the shank, and by grabbing them at the top, it allows you to actually save some real estate on the file. And here 24.5 millimeter is what it appeared to be, where we managed to get the length, and here it is, 24.5 millimeter is what we have. So now that we have a 1502 to the end, we're going to use our expediter file. Now that 1502 could have been a 1002, but I knew from the radiograph that we had a wide canal, so I said I started using a 1502 instead. So right off the bat, the ESRCM 2506 goes to the apex, indicating that what we have is we have a large canal. So being a large canal, we do our irrigation and so on first, and then I'm going to use the 40 to see where that goes. I'm just tapping it to see how far it goes. And yes, the 40 does go pretty much to the full working length, indicating that what I need to do now is I need to move up to actually 50 instead of using the 40. So I just remove the 40 and haven't even used it. And now I'm going to use the 50. And by the way, let me take a quick stoppage here to tell you that what's nice about these ESRCM files is, unlike the Wave 1 Gold and the other file systems out there that are limited for serialization to once, if you want to use something to gauge, such as the 40 that I just did, and you find out that it's not the right file, instead of that file being kind of ruined, because some of the other file systems out there, if you sterilize them, the file is non-usable by design by the manufacturer, because they kind of expand, the little rubber piece in there expands and prevents the file from being reused. Here, the ESRCM files can be re-serialized as many times as necessary. Of course, the manufacturer recommends single use in these cases, like any other file system. But what's nice is that these files come pre-sterile, but if you do open them, such as I just showed, and it needs to be re-serialized, you have the ability to re-serialize them rather than all of a sudden have to toss them. So here we use the 40, and now we're going to fit the 50, and we can see that the 50 is actually fitting at a couple of millimeters short of the apex, which is exactly what we need. That means that we're going to get some work done there, and just with a couple of rhythm motion, that size 50 reaches the apex. Now I'm using this 21 gauge side vented needle that Brasseler has. After a couple of irrigations, and I'm using negative pressure, I'm going to use the 25 millimeter closed-ended side vented 31 gauge needle to take all the way down to the almost full working length, so my hypochlorite can fully irrigate and remove the debris. Remember that reciprocating and negative OTR motions create a lot of debris packed on the wall, so it's important to clean them. I take my corresponding 5004 endosequence BC cone to fit, and it goes to the end, and I use the corresponding paper point to confirm the full dryness of the canal up until that point. A little trick here is to apply a little bit of air to the paper point to dry it up and wick up the solutions from there. And then I use the endosequence BC sealer, high flow, on with a minimal waste tip, and I'm using the same master file here, coming about a millimeter or half a millimeter short of the length. Now, because these files cut across in a counterclockwise direction, I'm using it in a clockwise direction so they can push it apically, and take the cone, butter it up, and seat it to the end. Now I sear off with hydraulic condensation at the gutta percha at the orifice level. I have actually a new tip, hydraulic condensation tip in the works that's going to become available that makes hydraulic condensation a little bit easier for you. Once the gutta percha has been melted off, I use a largest plugger to push the gutta percha down, and then ultrasonic and water removes the excess sealer. And now I'm just going to etch the access preparation, wash off the phosphoric acid, come back with a smaller plugger and just close off the seams, making sure that everything is clean, and then go ahead and use the BC liner here to fill up in bulk the access preparation. So that is, you have to make sure that you have an orange filter here when you're doing this, and then after you place the BC liner, you have to wait a good 30 seconds for it to self-etch and self-bond before you go ahead and just lightly light cure the surface, and you can let the rest of it self-cure for minimal amount of polymerization shrinkage. So I'm just going to play around with the margin of the BC liner, basically killing the 30 seconds for it to self-etch and self-bond, remove the orange filter, and light cure, and that's the final product. And we've moved on from a tooth that has had a traumatic experience and necrosis due to trauma to root canal treated and filling the access with the BC liner in a single visit. The BC liner can then be used as base, and you can drill a millimeter into it and seal the access with a more higher polish composite right at the very top. So it's a very simple technique, as you can imagine, and that is the essence of the ESRCM, a system of reverse cutting, reciprocating files that could be used with either your reciprocating engine or with the EndoSync Plus that has the capacity to do reverse OTR that allows these types of files that cut in a counterclockwise direction to apply OTR for your action. I'm really a big fan of the ESRCM system. I think it's a really nice system. It does cut very well, especially when used with the EndoSync Plus, because what this does allow you The EndoSync Plus is a reverse cutting engine, as well as forward cutting engine, obviously, that you can use with your regular files. But in the reverse cutting, this instrument or this handpiece allows you to manipulate the OTR torque setting so that you can actually have a far more efficient reverse cutting file. So either your ESR, ESR-CM, Reciproc, and Wave 1 Gold files using the EndoSync Plus can cut far more efficiently than pure reciprocation, because what you can do is you can play around with not only the torque setting for the engagement of the OTR, which if the higher it is, the more efficient is the cutting that you're getting, but you can also even change the angles of reciprocation from 130 to 180 to higher, even 270 in terms of the cutting direction of the file. All right, I hope it wasn't too much or too confusing. It's very late at night. I didn't get a chance to make my video, so I figured I'll do it now. I hope everything made sense. And if you did like it, please comment below. I always love to read your comments, and I do try to reply to the ones that are pertinent. So any questions you have about ESR-CM, write down below. It says the protocol for this particular system I kind of put together for Brasseler, because I think this is the best way to use the minimal number of files and get the most amount of efficiency and safety. I detracted them from promoting this as a single file system, much like the other manufacturers have, because I think it's an irresponsible marketing ploy to call a file a single file system or a one file system, because every system requires at least one file to go down there, screen and find out what type of a diameter you have at the apex before you can use a finishing file to finish up that size. So anyone who's talking about a single file technique, that's essentially a marketing slogan, because you can't determine what your final file size should be from a radiograph, a preoperative radiograph. You always have to go in there and then engage the canal, find out what should be your final finishing file. And that's why I believe, and we believe at Reworld Endo, that the minimum number of files to do a proper root canal is 2, not 1. All right, hope this was helpful. Very late, I'm gonna go to bed. For Reworld Endo, I'm Ali Nasseh, and let's save some teeth.